All right. So this is now being recorded. So the digestive system, what I want you to understand is digestion is actually, they shouldn't throw this into your last week because if you understand the digestive system, it'll help you understand what's going on in our country, especially with our diet. Everything that we eat has to be broken down into its fundamental units. So every time that you eat carbohydrates, so you eat a piece of bread, you eat some French fries, you eat anything like that, tortillas, you eat cake, you have stuff like that. The carbohydrates are going to get broken down into its primary elements, which is going to be normally glucose, which is one that we can use. But we have a lot of fructose added in. So high fructose corn syrup is added into a lot of our food. Now I want you to think about it like this. One Coca-Cola, you get yourself a soda, a 12-ounce soda. It has, I believe it's 19 teaspoons of sugar in it. Okay, it's equivalent to 19 teaspoons of sugar, but the kind of sugar is different. It's not like the sugar you have, at your table, which that is going to be glucose and glucose. It is going to be fructose and glucose. Okay, so fructose and glucose, you have to think about this. That is high fructose corn syrup. Now, when we have more fructose than we usually have, that's what they mean by the high fructose corn syrup. If you were to take and you drink that soda, that Coke, with all that sugar in it and having it be high fructose corn syrup, half of the glucose that was partly in there goes into your bloodstream. That glucose is going to be used for energy. So our muscles are going to burn it. Whatever our muscles don't burn, insulin then is going to take and it's going to hit our receptors and it's going to say, hey, take in this glucose. And that glucose is going to go, for insulin, goes to muscle and fat cells. So that glucose then won't get converted into fat, which doesn't get burned for energy. But when we drink that soda, we get so much glucose that runs out in our bloodstream. The fructose, when you eat an apple, apples have, all your fruits, they have fructose and glucose. But the ratio is much lower than high fructose corn syrup. So think about this for a second. There's as much fructose in one Coca-Cola as there is in 12 apples. Nobody eats 12 apples at once. Now, all that glucose went into the bloodstream, so now we spike our insulin, and our body says, hey, we have enough glucose, don't send any more out. But then the liver is like, what am I going to do with all this fructose? And normally what the liver would do, you eat an apple, the liver is going to have enzymes that will convert fructose into glucose and send that out to be used for energy. But since we already have too much glucose in our bloodstream, and we have all this fructose sitting in our liver is like, well, this is fructose. We can convert it to glucose, but we don't need it. So what we're going to do then is we're going to store it for energy later. So what it does is it takes that fructose and it converts it into fat. But the problem is to convert it into fat in the liver. And then we keep getting more and more soda in there. So more and more high fructose corn syrup. What happens now is we have fat cells in our liver, and those fat cells keep getting filled up because the fructose gets getting converted into fat. Eventually those fat cells get bigger and bigger and bigger, and they put stretch in the liver. So now the liver gets large. So now I get hepatomegaly. When the liver gets large, what happens then is the connective tissue in the liver gets stretched and it gets irritated. When it gets stretched and irritated, it causes an immune response, which then causes that to get hardened. Cirrhosis. So fatty liver disease is very common in America right now, especially in our children, because of all the fructose. So now what happens is fatty liver disease leads to cirrhosis of the liver. If you get cirrhosis of the liver, the liver can't function because it is having a hard time getting all the nutrients into it and out of it. We'll talk more about that in a little bit. But that's a health issue, and you're going to start seeing a lot of that. So carbohydrates have to get broken down into glucose, it's primary sugar. Protein, so you eat some meat, and that meat then is going to get broken down into its most basic feature, which is going to be amino acids. The amino acids then go into your bloodstream, and the amino acids then, cells will take the amino acids and put them together into a protein. So it could be a structural protein or a functional protein. Functional proteins, think about those as like enzymes. Structural proteins help keep the cells and things like that in shape. How many people have heard about what's the latest rage out there right now as far as making you look better and stay fit and all that stuff? The peptides? How many people know what a peptide is?
Peptide, isn't it some sort of amino acids?
You take the amino acids, you fold them up to make a specific protein. The thing about these proteins are they have a specific shape. That shape is going to cause a reaction. I forget what the receptor site is on your hair follicles. that are responsible for putting the melanin in your hair. But eventually those receptor sites, they don't really work well. And so the cells that actually where your hair grows, they stop producing the melanin. So then what happens is your hair loses its color and it becomes gray. And the actual structure of the hair becomes even different because gray hair is more wiry and it grows faster. So they now have a peptide that will actually go in and it will reset the cell because that peptide is a specific protein and that shape will hit the cells in your hair follicle that say, hey, start producing more of the melanin. So it actually makes your hair thicker and it brings back the color it used to have. So gray hair eventually is going to be a thing of the past. So they're doing a lot of work with peptides, and you'll see a lot of that stuff. Okay, so proteins get broken down into amino acids. What do fats get broken down into? So all your lipids, they're going to get broken down into fatty acids. Now here's the trick, is fatty acids, we need fat, we need cholesterol, we need this stuff. Our cell walls are made of cholesterol. A lot of our hormones are cholesterol based. So the fatty acids though, because fat, if you put oil and water, they separate. So we need an emulsifier to make it so the fat can actually travel through our bloodstream without separating out. So that emulsifier is actually going to be bile. Okay, so fat gets absorbed from our intestines through something called the lacteals, and we'll talk about that in a second. The lacteals though actually take bile and they encircle the fat, so that it will now be emulsified so it can go through our bloodstream. Okay, the thing about it is, why does fiber bring down your cholesterol? What fiber does is a high fiber diet holds on to bile. So the bile then goes out in your poop. So you remove the bile. Now, since bile is actually made out of cholesterol and bile salts, okay, when you get a bruise or you get a big hickey when you're young, you ever notice how the coloration of it changes? It goes from looking like a dark bruise to then it gets that like weird yellowy green look. That yellowy green look is bile. So that bile now, we're going to get rid of a lot of it in our urine. That's why our urine is a yellowish color. The bile is actually released when red blood cells get broken down. So bile though, when it's mixed, that's called bilirubin. The bilirubin, which is in your red blood cells, when bilirubin gets mixed with cholesterol, it becomes bile. So then the bile then is stored in your gallbladder. The bile is used to absorb fat. I know we're talking about a lot of stuff. We're going to go into it again. This is stuff you need to know. Okay, so your digestive system is basically just going to be your mouth, your pharynx. So the pharynx is the pharynx is actually right above your larynx. Then from the pharynx, we're going to have what's called our epiglottis, which flips down. So what that does is it makes sure that food doesn't go into our trachea. So that's going to dictate what direction of food and drink. So it goes down the esophagus. The esophagus is right behind the trachea. The trachea has a U-shaped cartilage to keep it open. It's a U shape, so when you swallow, the esophagus can open up and kind of go into that U. So we can swallow our food and drink. Then it goes to your stomach. So in your stomach, we're going to start to blend everything together. So we're now going to start to break down all of our food. Now, our mouth, our teeth mechanically broke it down. Our saliva, we have salivary amylase, starts to break down our carbohydrates. Now, when everything goes down through the esophagus, it hits our stomach. In our stomach, we're going to add some enzymes to it and hydrochloric acid. The hydrochloric acid and these enzymes are going to chemically break down these nutrients into what? It's going to start trying to break it down to fatty acids, amino acids, and glucose. Then it's going to empty from the stomach into the small intestine. Now, the first part of the small intestine is where we're going to have our common bile duct to get bile from the liver. And it's also where we're going to have our pancreatic duct, where we get pancreatic juices from the pancreas. Digestive juices, we'll talk about those in a little bit. To further chemically break down our food. Now, the small intestine is where we're going to absorb nutrients. So we get most of our nutrients in the small intestine. The large intestine is where we're going to absorb water. Okay. Now, to understand this, our small intestines and our stomach. So our stomach gets a lot of liquid in there. Our small intestines, then, we add more liquid into it. So we actually turn this thing. So as we're chewing our food, it becomes what's called a bolus, because it's a ball of food. You swallow the bolus down. Once it hits your stomach, it becomes chyme, chyme. The chyme is this digestion that's going on. Leaves your stomach, and it goes to your small intestine. Okay, so as that chyme is going through your small intestine, I want you to think about this. We are now trying to break the nutrients out and absorbing the nutrients. When it hits your large intestine, it's really watery. We all understand that, and it gets really watery. If you've ever had, food poisoning, you get diarrhea. It's just water coming out. So your large intestine, what happens with that is it's going to reabsorb the water. So we're going to take water from this chyme, and as we keep removing the water, it's going to get more and more firm. So it's going to start turning into a poop. So I want you to think about this. The next time you get all romantic and cuddly with the person you want to be with, realize that some of that spit, some of the liquid that is in their mouth, some of the liquid that they have in there, at one point was actually removed from feces. So, yeah. I had to keep the romance going. Now, the accessory organ is going to be teeth, tongue, salivary glands, pancreas, liver, and gallbladder. We'll go into all that stuff. So, hey, nobody ever said anatomy was like clean and pretty. Okay, so right here is going to be the pharynx. Then it goes into and we avoid the trachea, we go down the esophagus. So when the esophagus goes into the stomach, the little section right there where the esophagus and the stomach meet, that's going to be a sphincter. A sphincter is just a circular muscle that can close and open. That's referred to as the cardiac sphincter on that area because it is on the upper portion of the stomach. Now, heartburn happens when that sphincter doesn't close all the way. So some of the stomach acid goes up into your esophagus. Okay, it's the lower esophageal sphincter or the cardiac sphincter. I don't know why they have to give it two names, but they did. If you get heartburn, it's because the stomach acid is coming up and it's going into your esophagus and it's starting to burn that. Okay. Let's see. We already talked a lot about this. Don't worry too much about all these different layers. The one thing I want you to be aware of is the mesenteries. So your mesenteries are just connective tissue that holds your organs in place. That's all there is to it. Now, you can see that the lining of your intestines, it has these little projections that come out. That's referred to as microvilli. What that does is it increases the surface area of your intestines to allow for more absorption of nutrients. That's all you have to understand with that. This right here is pretty much just what it looks like. Now it's mucosal tissue because it has mucous membranes in there. So it makes a lot of mucus. So we all understand that stuff. People who actually have, where they have a problem they can't eat wheat, where they actually have a gluten, like they really cannot have gluten because they're allergic to it. Can't remember the name of that disease. It'll come to me in just a second. But one of the things that it does, celiac disease.
Celiac disease?
Yeah, celiac. People with celiac, it actually wears away this lining right here. So it takes care of the microvilli. It destroys those. So without the microvilli, people who have celiac disease, they can't absorb the nutrients. So what kills them is lack of nutrients. So that's why it's such a bad disease. And because they're not absorbing stuff, whenever they have gluten, they're going to get like a really bad allergy attack and it's going to just shoot through them. It's a horrible thing to have to deal with. They go into too much detail on this stuff. Okay. Now, peristalsis, all you need to understand is peristalsis is the rhythmic movement of tubes to push whatever's inside the tube along. So it's basically if you're ever, trying to take the casing off of some sausage or chorizo or something like that before you cook it up, it's just peristalsis is just the movement of pushing things along. Okay, so it is smooth muscle. We know smooth muscle is what? It is part of the autonomic nervous system. It is not part of the somatic nervous system, so we can't control it, which is the reason why digestion happens at all times. So peristalsis is the movement of something through a tube. That's all you have to understand with that. It's just showing you how it's going to constrict. The muscles constrict, and as they constrict, it's in a rhythmic fashion. So it constricts, and by constricting, it keeps pushing the chyme or the poop along.
So is that why sometimes you get cramps or something? It's because of that, or?
Yeah, you get cramps because of that. Sometimes it squeezes really hard, and if there's gas in there, it'll squeeze the gas, but the gas, when it pushes it along, when it relaxes, comes back. So gas can cause a lot of pain. What makes the peristalsis happen is you get distension. So when the tube gets pushed open, it causes stretch receptors to say, hey, start squeezing and moving it along. Now the problem is with some people, if you are chronically constipated, if you hold on to your poop for too long, what happens then is it starts to, just because if there's water in there, our large intestine is going to keep absorbing it. So if we keep taking the water out of it, the poop then gets smaller. You're like, okay, well, if it's smaller, it's not going to cause stretch, but there's more that's backing up onto it. But it gets smaller, and it gets drier, and it gets harder. And now it is hard for our intestines to push it along. So this happens to some people really bad, especially when they get older, where they refuse, like they can't poop anymore. And it's called impaction. And what they have to do then is actually try to go up there with like forceps and pull it out sometimes. Once they unplug it, that's why you want to be the RN. You don't want to be the one they send in to go and clean it up. Don't worry about the peritoneal stuff. So you can see here the mesenteries, how they just hold everything together. So you've actually had to deal with that, Cindy, where they actually pull it out? If you work in healthcare, especially in like nursing homes, yeah, that happens all the time. Let's see. Don't worry about the mesentery. But you can see here how it holds everything in place. It's like here's your stomach. Here's this one, it's called the omentum. It goes all the way down here. You can see how it grabs hold of the large intestine and attaches it to the wall. Mesenteric fat is the belly fat that we get.
You said the belly fat?
You ever see somebody with that big beer belly that sticks out?
So now if you have more fat, it'll be better because it's holding your stuff much more together.
You have to think about it. The mesentery and all these tubes and everything in here, they're designed to actually absorb shock, which is the reason why your abdominal pelvic region doesn't have any bones in there for protection. The protection is going to be muscle and fat.
Yes.
But for some reason, people that drink a lot of alcohol or beer, because it's got a lot of calories in it, it actually stores the fat along this area in the mesentery. So that's why that beer belly sticks out and it's kind of like all rounded.
They look pregnant.
They look pregnant, but if you ask them, they're going to be like, well, you got to build a shed if you got a good tool. So. Let me see. Yeah, the reason why they talk about and your mouth and your tongue and all that is they want to look at your mouth and tongue to see how well you heal, especially if you're on chemotherapy. How many of you have actually like burned the roof of your mouth on a slice of pizza or something, or you bite the side of your cheek? How fast does that heal? That always heals usually within a matter of like 3 days, because the cells on your cheek and your tongue, they replace fast. Now, if somebody's getting chemotherapy is going to affect the cells that have the greatest metabolism, which is why their hair falls out. It's also why the mouth, if the chemo is really strong and too much from it, they'll start to get sores in their mouth. So they take a look to make sure they can tell how all the cells are reacting. Now just note the soft palate right here. All the soft palate really does is the soft palate is going to, when you go to swallow your food, so here's your soft palate. When you swallow your food, the soft palate flips upwards. So by flipping upwards, it is going to block food from going into your nasal pharynx. So it keeps food from going up and through your nose. We've all seen somebody, it's happened to us, you know, you're trying to take a drink and somebody tells you something funny and all of a sudden you get yeah, you wind up getting the beer suds coming up here. Let's see. Now my thing is, I don't know why they had to make it so that this picture right here, it looks like all these teeth have cavities in them. But as you can see the uvula back here, what that is it's hanging down off of the soft palate. When food hits that, the reflex makes so the soft palate is going to flip up so that we don't get food going into our nasal pharynx. Okay, let's see. Now the main thing about the tongue is it's going to help to move everything around, but it also has your taste buds in it and everything. Now the thing about the tongue though is it's rough, so it has a papillae. The papillae that's on the tongue, remember, that is going to be where our taste buds are, and it's going to be the glossopharyngeal nerve. It's going to be the one, listen, glossal means tongue, pharynx, the back of the tongue, glossopharyngeal, and the facial nerve. The facial nerve is going to have the taste buds for the anterior 2/3, glossopharyngeal, back of the tongue. Now, those papillae, they're important because they help you control the food. Now, we're going to also have some salivary glands. Let me see if we get into that.
Have you seen some people, they get their throat like by there it's like there are something in their mouth like it's coming out? Like, what are those? Like,
are you talking about the tonsil rocks?
I think so.
Yeah, you'll know tonsil rocks because some people.
How do you get those? It's like so weird.
Well, for some people, you have to realize that the tonsils, what they are is it's an area with a lot of white blood cells to fight off infections and stuff. Sometimes a little piece of food, people are prone to it. They get some food stuck in here. And then the white blood cells start to attack it. And that little piece of food starts to like rot as the white blood cells are attacking it, which is why people that get tonsil rocks, they tend to have really bad breath.
Oh, jeez.
So sometimes they have to like scrape those things out and pull them out.
Oh, hell
Because it's
no.
like rotting food. Come on, we're actually kind of disgusting inside.
That's why they say some people when they have like a white like tongue, it's not as healthy as.
It could be a sign of dehydration. And we're going to talk about that when we go into the kidneys. If the tongue is kind of swelled up and smooth, that is a sign of severe anemia. So that's like pernicious anemia going to a bad level. So the mouth can tell you a lot about what's going on with somebody. Oh yeah, the frenulum on the tongue, on the underside of the tongue, right here. So we also have a frenulum right up here on your upper lip. So if you put your tongue in between your upper teeth and your lips, you can feel that little string. That frenulum is where our bodies in embryology came all the way out and grew and came together. So that's where we fused up. So we also will have it on our soft palate too. You can feel where it all came together and it fused. It's on our tongue. So our entire body, think about that, it all grew from right and left and eventually it came together and touched. Now, for us guys, what happened is when it came together, our penis actually started to come together the same way. Because our penis grew in embryology from like inside of our abdominal pelvic cavity. So when it grew, the frenulum is actually looking forward. But then when our penis actually came down, the frenulum's on the bottom. So that's the reason why on the guy's penis you can actually see where it came together.
I've seen some babies, they cut that thing, especially the bottom tongue or something. They say they can't.
Some people actually get the frenulum on their tongue cut because they say that sometimes it gets tight and the tongue doesn't move as well as it should. There's like a new surgery for that.
Yeah, they do it when they still like infant, like literally just like newborn. I've seen it. They do that on newborns.
Oh, that's strange. Well, if the tongue's not moving right, then yeah. Don't worry too much about the glands. Just know that the glands, the salivary glands, they have mucus in them, enzymes, and just plain liquid. The submandibular one is more of a liquidy one. The sublingual is one that actually has a lot of salivary amylase, and the parotid has more mucus. And what this does is it actually, the spit, it makes it so that we're going to form that ball, that bolus. The tongue, the ridges and bumps on the tongue, all the papillae, they make it so that we can actually hold on that bolus and bring it to the back of our mouth so we can swallow it. If we don't have any saliva, it becomes really hard to control the food. Look, it's all legal now. If you want to like smoke out and get a bunch of weed and get cotton mouth and try to eat a bag of Doritos without anything to drink, it's kind of tough, I've been told. What are the rules? I always ask my students this. Like I know that they drug test people to be working in hospitals. You can't be taking drugs. But what is the policy? Because things are just changing so much when it comes to weed. Like I know in the VA, you're going to get tested. If you were tested and you're smoking weed, you can't get hired because federally it's still a crime. But in California, it's not.
I believe you have to have a medical license and a note from your doctor that would get you medically exempt.
Yeah, so they're still doing it that way. Let's see. Well, I'm going to go into the teeth aspect because the one thing I will tell you is when it comes to your teeth, and this is something you will see, especially here in LA. So the enamel is white, very hard, very white. That's how we're supposed to have it. The dentine, like dentine gum, it's named after this stuff, is underneath the enamel. Now the dentine is actually a yellowish color. Okay, here's the problem. Is some people get obsessed with having white teeth, and so what they do is they take these teeth whitening strips. And if you use them the way that they're indicated, you'll be fine. But some people will put the teeth whitening strips on, and they'll leave them on for like, a couple of hours, and then they'll do it another day. And they don't care that your teeth are hurting. They keep doing it to try to make them white. And what happens is, if you overdo the whitening strips, it starts to wear away the enamel. The enamel gets so thin that the dentine starts to show through it. The next thing you know, their teeth look like sticks of butter because they have worn away all of the enamel. So what's showing out is the dentine, which is yellow. So they will get nice white teeth pretty soon because they're going to wind up in the dentist and they're going to wind up having to get veneers. A root canal is when they have to go digging all the way down through here to try to get that tooth out. What causes cavities?
Sugar.
Oh. Why does sugar cause cavities? Okay. So I want you to listen right here. This is the way it works normally in America. Why is it that, when people get to be in their 40s, a lot of times they wind up with high blood pressure. They get high blood pressure, they put them on pills that are going to control their blood pressure. It might be losartan, lisinopril, something like that. A lot of these blood pressure pills, they also play with the kidneys and they make you urinate more. So you get rid of sodium, you hold on potassium, and you urinate more often. So now you wind up getting dehydrated. Get dehydrated, you have less volume in your blood vessels, less work for your heart. Okay, just listen here. So, dehydration. What's the first thing that your body stops making when you're dehydrated? Okay, it stops making saliva because it's trying to hold on to liquid. So now you stop making saliva, so your mouth is permanently always dry. That dry mouth actually makes your gums start to shrink. Now, dry mouth, we also have lysosomes in our saliva which kill bacteria. So they keep the bacteria in our mouth the way it should be. Well, with a dry mouth, our gums get dry, they start to shrink down, so the gums recede. Now, when those gums are receding, there's a lot of bacteria on those gums. Bacteria on the gums, they start to eat away. So when bacteria gets a lot of sugar, carbohydrates, it gets a lot of nutrients. So now the bacteria starts to grow wild and it starts to reproduce a lot of byproducts. The byproducts from the bacteria is acidic. The bacteria acidity from having sugar so that it can grow is the acid from the bacteria that eats away your teeth and gives you a cavity. But the same thing with that bacteria in your gums, it causes irritation. That irritation in your gums actually sends out something called C-reactive protein. The C-reactive protein hits your blood vessels and causes your blood vessels to get inflamed, which then can lead to a greater chance of having a heart attack. So that's the reason why when you start taking blood pressure pills, you should chew more gum, you should drink more, you should try to make sure that you don't get dehydrated. Let's see. You don't need to know all this stuff. Just showing how you actually swallow your food. They go into too much detail on all this.
I have a question.
Sure.
If people taking the blood pressure medication, but they have heart failure and swelling, is that still have to have a good enough water, or they have a restraining for the amount of the water to take?
So when you start to have heart disease like that, then they're going to put you on a lot of times they'll put you on a Lasix or something to try to get you more dehydrated, but you still have to drink water. Not excess amounts, but you still have to drink to try to make so you are going to be hydrated enough. Because if the heart, so what you're talking about is you're going into heart failure, right?
Yes.
Okay, so with heart failure, a lot of times it's congestive. So a lot of times the high blood pressure made it so the left side of the heart was working really hard and it couldn't push the blood enough. So it couldn't get enough blood out of the left side of the heart to get into the body. It was struggling. So if the blood didn't leave the left side of the heart, it backed up into the lungs. So now when it backs up into the lungs through the pulmonary vein, so when it backs up into the lungs, we now wind up getting pulmonary hypertension. So we can have fluid leaking out into the lungs, which is why when people that have congestive heart failure, a lot of times when they cough, it's very productive. Well, if we can't get the blood through the lungs, then it's going to back up into the right side of the heart. So now I have a hard time getting the blood out of the right side. So now that's referred to as biventricular congestive heart failure. If we can't get the blood out of the right side of the heart, that means we can't get blood into the right side of the heart. Since our veins bring blood to the heart through the superior and inferior vena cava, if the veins can't bring the blood in, then that starts to back up and we have pressure in that. So congestive heart failure means it's hard for the blood to get back to the heart. So then we wind up with pressure in the veins, we wind up with liquid leaking out of it at the capillary area. So that's the reason why they get pitting edema around their ankles. They start to get bloated. They might have ascites, which is fluid around the midsection, around the mesenteries. And that is because that fluid can't get through the blood vessels into the heart, so it leaks out. Does that make sense? So it's
Yes.
Are they supposed to drink more? Yes, because we don't want them to get dehydrated. But they have too much fluid in their body, so then we put them on Lasix to try to make them pee it out, so that then they can get that fluid back through their heart. It's a weird balancing act.
And they will have a kidney problem after that.
Yes. Kidneys play a big role. Remember, kidneys regulate blood pressure, blood volume. Okay, so here is the lower esophageal sphincter. This is the pyloric sphincter. Best way to understand the pyloric sphincter is H. pylori is a bacteria that actually will get into the stomach lining and it will cause irritation and it can lead to an ulcer. The most common cause of an ulcer is H. pylori. By the way, H. pylori, the way you catch it is through fecal oral. Okay. Now the gastric folds inside, those are referred to as the rugae, which is the reason why your stomach can actually expand. Your stomach is the size of your fist. But when you go to a Vegas buffet, what do you do to that fist? You stretch it out. That thing becomes like a watermelon. Because this rugae will actually open up and allow the stomach to expand. You really want to see a rugae in action? There's the Nathan's hot dog eating contest that goes on the 4th of July. Okay, they actually take the hot dog, stick it in water, veggie bun and all. That's crazy. I mean, nobody should be able to eat, 50 or 60 hot dogs in a matter of 5 or 10 minutes or something like that. That's crazy. And what that does, though, is eating like that, it stretches out the rugae. There's a female who she used to win a lot, and she was from Japan, and she was a tiny, very petite lady, very attractive. But can you imagine taking her out and trying to buy her dinner when she's training for an eating contest? But they actually think that she has a connective tissue disease, Ehlers-Danlos, where connective tissue has more laxity, so her stomach can expand more, which is why she doesn't get sick. Don't ask why.
I actually know who you're talking about, Professor. She's like always winning, like
She's always,
pizza eating contests, and there's like 20 guys, and they're all looking at her like, what is going on?
Yeah, and she's not that big.
Super tiny.
Yeah, it's like, okay, I don't know what she's doing with it, but I wouldn't want to date her while she's training. Can you imagine trying to pie that dinner? Okay. What I want you to see here is just, we have all these arteries that come in here. So when you eat, why do you get so tired when you have a big, heavy meal? Because all that food, all those nutrients are going through your small intestines, going into your large intestine and everything. So what's happening now is your body, under what nervous system? Your parasympathetic. It says, hey, rest and digest. So when you have a heavy meal, a lot of your blood goes into your intestines to absorb those nutrients. So your arterial blood gets sent in through the celiac and mesenteric arteries and things like that.
And then imagine you wearing a tight jeans at that time.
Well, that's the reason why, when you go to Vegas for the buffet, you got to make sure you have a place to like unbutton it. You got to make some room. When they talk about the parietal cells, I want you to just think about that as pH. pH is the acidity. So your parietal cells, they make their hydrochloric acid. Now, you need to actually, and think about this, for people that take these proton pump inhibitors, the people that take all these antacids, if you reduce the acid in your stomach too much, you have a hard time doing what? Absorbing vitamin B12. You need B12 in order to make red blood cells. Okay. So hydrochloric acid comes from the parietal cells. It starts to break down pretty much everything. Okay. The chief cells, what they do are they're going to secrete something called pepsin. So pepsin, what it does is it gets activated by the hydrochloric acid, and pepsin starts to break down the proteins. It's just kind of showing you all the pits and everything in there. Now, the only reason I bring this up is a proton pump inhibitor. So what is a proton? So a proton is nothing more than you remove an electron. And if you remove the electron from an atom, which is the main first atom on the periodic table of the elements, is going to be hydrogen. So hydrogen is one electron and one proton. If you remove the electron, that's just a proton. You spit that out. So the parietal cell is going to spit out that electron. Then we're going to have chloride, which is stored in other cells. That gets released, and it forms hydrochloric acid. What makes something acidic is the amount of hydrogen in there. So since a hydrogen atom can be broken down into just a proton, when people take something because they have chronic stomach acid, they have heartburn, they take something called a proton pump inhibitor, a PPI. Okay, you get those over the counter, your Pepsids, and things like that. So if people are abusing the proton pump inhibitors, they're going to stop the release of proton, so they're going to lower the stomach acid. If they lower the stomach acid too much, it then makes so your stomach is more susceptible because it's not going to kill the bacteria and anything you might eat, but it also makes so you can't absorb B12. So if somebody has anemia, you could be like, how's your stomach? Now, if their stomach is fine and they have enough acid, then what you have to start thinking about is, okay, there's another thing that your stomach produces called intrinsic factor. Intrinsic factor is needed to absorb B12 as well. So if their stomach has enough acid and they have intrinsic factor and they're still not absorbing B12, then you have to start thinking maybe there's something going on in their small intestine, the distal ileum. These are all things that are ways to track down what's wrong with somebody to see why they have anemia. They're just hormones that actually make everything start to. Okay, so I want you to be aware of here is the first part of your stomach. So your stomach empties. So your stomach would be right in this area. So this would be where your stomach is. That's a very bad stomach. But this part right here is called the duodenum. The duodenum. The duodenum is the first part of your small intestine. So the duodenum is where we get the contents of the stomach, the contents of the pancreas, and bile from the liver. So that is where we get all the digestive juices and everything together at the very first time. So that's going to be your duodenum. Your duodenum then is going to turn into your jejunum. So the jejunum is just another part of your small intestine. The jejunum then is going to empty into the ileum. The ileum then is going to empty into your large intestine. Where the ileum and the large intestine come together, there's something called the ileocecal valve, and that is where your appendix is. So if somebody gets appendicitis, they're going to have really sharp right lower quadrant pain with a fever. Fever because it's an infection, appendicitis. Now remember, what's going on in your small intestine? We're absorbing nutrients. Okay. All nutrients get absorbed in your small intestine into your bloodstream, except fat and fat-soluble vitamins. Fat gets absorbed into your lacteals, the green spot right in here. So your lacteals, actually then, that fat is going to go into your lymphatic system. Then that's going to go up and it's going to your subclavian veins, and then it gets dumped into your heart. And that's how fat gets traveling around in the body. So lacteals are where we absorb fat.
So is that true? If you like when you're really hungry, and then like let's say you eat some like healthy meal, whatever it has, like proteins and all of that, and then you eat like the dessert, like sugar. So the sugar, because you eat that at the end when pretty much you're full, it doesn't get as bad as to your bloodstream, the sugar, as if you're eating that as a, like, you know, empty stomach.
So here's the thing. If you eat a bagel with butter, just like a plain bagel with like butter on it, that bagel is going to be converted into just glucose right away. That's going to spike your insulin. But if you were to take the bagel and you put like some turkey on there, you make it into a sandwich. So now you're mixing the bagel with a lot of proteins and some fats and stuff. Then what happens is it doesn't get broken down as fast. So if you have a combination of food, it does take longer to break down that sugar. Does that make sense? If you just have a piece of cake, boom, you're just going to spike your insulin. But if you have it after you had another meal, then you're probably going to be okay.
Yeah.
So it's all about, that's why they have something called the glycemic index, which is how much this one particular amount of this food, this particular food, how that's going to spike your insulin. So you have your glycemic index, and then you have your glycemic load. The glycemic load is how is this sandwich, depending on what kind of sandwich it is, how is that going to affect your insulin? Two different charts.
So that's why when like you go to restaurants, first when you sit at the table, they serve you like just some sort of bread and butter to like kind of make you more.
It's not going to fill you up.
Like, yeah, you feel like you need to order more food from them.
Yeah, so the bread and all that stuff, because that bread, and normally it's going to be like a simple white bread, like dinner rolls, it's going to get absorbed really fast. So it's going to spike your insulin. It's going to start to pull glucose out of your bloodstream. So it's going to say, hey, I'm still hungry. It's the reason why bars, they serve you salty snacks, because the salty snacks will actually make it so that you feel a little more thirsty.
Oh, wow.
Everything's a trick. You go to the movies, you have a small popcorn. Okay, you see the price of small popcorn. Then the medium popcorn, the price of the medium popcorn is really close to the price of the large. But there's a big difference between small and medium. But the difference between medium and large is not much. So people think, hey, it's a better value to get the large because it's not much more than the medium. But it's significantly more than the small, which is why mentally more people buy the large thinking it's a better deal. So the movie theaters actually Plus the popcorn smell with the fake butter and everything, they're having that, and that comes in, and you smell it, and that hits it hits the limbic system in your brain, which makes you, oh, that smells good. I want some movie popcorn. So then you get that with the extra butter and everything. You spend like, I don't know how much money on popcorn now.
It's crazy. Sometimes when you're hungry, it's like your body naturally starts producing more kind of saliva, and you be like, ooh, like, I want more.
Yeah, your body knows what it wants. Okay, got to get into where we're going to show some stuff here. See, I don't like the way that the book actually shows all this. It jumps all over the place. Okay. So all you have to know here is this is where the ileum is going to empty into the large intestine. This is the ascending, so this is moving upwards. So it's very liquidy here. When it gets up under the liver, that's why it's called the hepatic flexor. It's now going to flex over. It becomes, so you have the ascending, the transverse, because it's transverse from the right to the left. Then when it gets over here to the left, this is called the splenic flexor because it's under the spleen. Now we're going to the descending. The descending colon now is going to go down, and when it gets down to where like the hip bones are, the pelvic area, then it's going to swerve over. That becomes a sigmoid because it looks like an S. Then it goes into the rectum. And as you can see right here, this person is definitely ready. So we have an external and an internal sphincter for the rectum, which is going to control when we go and when we don't. Okay, so when it comes to the liver, and they really need to like spend more time on the liver, because the liver itself is going to make it makes a couple thousand enzymes. It's going to make digestive juices, mainly bile. The liver is going to be the organ. It's the second largest organ in your body, second only to your skin. And what the liver does is it neutralizes toxins, so it detoxifies. It's going to synthesize, and it basically makes it so the body is going to stay healthy, and the liver is going to be where we actually store a lot of glycogen. It is one of the most important organs in the body. It's so important that it's one of the only organs that can actually, if you donate liver, so you can donate a chunk of your liver to somebody, a big section, and your liver is the only organ that can replace that. In time, it will grow back. You're like, well, then how does the liver get damaged? Well, small damages eventually will take its toll. Okay. I want you to think about this. In the liver, we have a lot of blood vessels that go to it. We also have the bile ducts. So the bile ducts then are going to go from the liver, and what they're going to do is they're going to empty into the gallbladder. The other thing, though, is I don't know why they're not showing it on here. I don't like this at all. Okay. So the veins. Arteries go into all the intestines. Then we have a lot of veins. The veins then take the nutrients from the intestines, and it sends it over to the liver through something called the portal system. So your portal veins, they're going to import the blood from your intestines over to the liver, so they can start to manufacture, gets the nutrients from what you ate, and it's going to make that into whatever it is that your body needs. Okay. The gallbladder, all it does is stores bile. Bile gets stored up in here. Now, we have your biliary ducts that come down. The biliary ducts, when they come down, they're going to go all the way down, and they're going to combine with the pancreatic duct. Now, you can get a gallstone that's going to plug up this area right here. So you get a gallstone in here. It's going to plug up the pancreatic duct, and then the pancreas can get enlarged too.
How about some people, they get their gallbladder removed?
Yeah, because they get these little stones in here, these gallstones, and the gallstones get really big. Now, when you eat, you get released from your stomachs a hormone called cholecystokines. And what that does is it actually causes your gallbladder to contract. So the gallbladder then is going to contract, it's going to push the bile out. Now, if you have a bunch of rocks sitting in here, these gallstones, so if you have a bunch of rocks, it's basically like if you have rocks in your hands and you squeeze hard, it's going to hurt. So that pain is going to be really bad. And they'll take a look and they'll see there's gallstones, and they can remove this. Now, if they remove your gallbladder, you still make bile that comes from your liver. You just don't make as much. But if you don't make as much bile, what's going to happen if you have some really fatty food? What's going to happen if you have a lot of butter? What's going to happen if you go to In-N-Out? You're not going to be able to produce as much bile, so you can't absorb the fat. So then the fat's going to travel right out of your system. So you'll wind up with, you got to watch yourself. One of the signs of having gallstones is very bad right upper quadrant pain, made worse by eating high-fat food especially, and stomach cramping and diarrhea because you can't absorb the fat.
Yeah, the pain, it's really bad. I had a classmate, oh my God, it was horrible.
Yeah, it is bad.
Because she was screaming and crying, like unbelievable.
Let's see. And as you can see here, we have your bile duct comes in and it is going to mix with the pancreatic duct. Comes through here. So your pancreatic juices are going to be pancreatic amylase to break down your carbohydrates. Let me see. Pancreatic lipase. Lipase means it's going to be breaking down fat into fatty acids. And what's the other one? Pepsin. And it's another protease which breaks down protein. It's not on the test, so I guess the book does a horrible job explaining the intestines. So when you drink too much, binge drinking, you damage the acini cells that actually help make the pancreatic juices. And when those get damaged, it makes the pancreas get enlarged. Yeah, peptidase. That's the protein one. All right. That's pretty much it when it comes to the intestines. I covered everything you need to know.
So is it really if someone has a fatty liver, like when they're still young, they can get rid of it by like their diet, exercising and stuff like that? Or
You can change your liver. You can make your liver healthy again. Proper diet and exercise. But if you started to get cirrhosis, which is scarring, you can't change the scarring.
oh,
So that's the problem, is you have to catch it while still in the fatty stage before the fat gets so large that it puts a lot of stretch on the connective tissue of your liver, and then it winds up being scarred. And once that happens, then we have what? Cirrhosis.
so but once the cirrhosis happened, then that's it. You can't like take medication or something to.
You can take things to try to bring the inflammation down to prevent it from getting worse, and then you have to like watch what you eat and drink.
So how do you know you have cirrhosis? You get those ulcers or something, and then you see the change in your poop, or how?
Most people won't know they have cirrhosis until they wind up with, when they eat, they can't digest things, and so they're going to start pooping more. It's going to be runny. It's going to be more diarrhea. They're going to have like cramping in their intestines, and they're going to wind up with yellowing around the eyes, yellowing of the skin, because your liver can't get rid of the bilirubin. So the bilirubin is still being produced because our red blood cells only live 120 days. So red blood cells get destroyed, bilirubin gets converted into bile in our liver. So if we can't do that conversion, bilirubin builds up and we get jaundice. So jaundice is usually the key sign that we have cirrhosis. That means that it's gone too far, the liver is now damaged. Jaundice can also be because we have hepatitis. So hepatitis means the liver is being destroyed. Now, I need to also let you know that jaundice can be a sign of cancer that has metastasized to the liver. Because if you think about this, if we have colon cancer, then the cancer is going to grow and it's going to get into the submucosal layer, where then it gets into the blood vessels that are going to your intestines. Well, if that cancerous cell gets into the blood vessels, then it's going to be sent over through the portal system to the liver, and then it can actually infect the liver. And then the liver is very, very, very rarely ever going to be the primary source of where the cancer started, but the liver is very commonly the place that cancer metastasizes to, because it gets so much blood supply. Does that make sense?
Yes.
So once things metastasize to the liver, things are really bad. Let's see. So the urinary system, the only thing I want you to understand with it is, when it says regulates plasma ion concentration, it just basically means it's going to be what? It's going to hold on to sodium or potassium. That's going to be done by aldosterone, which comes from where? Your adrenal glands. Okay, so your adrenal glands help to regulate your kidneys, so that is going to hold on to the right concentration of sodium, potassium. It'll also help to hold on to the right of chloride, calcium, all the ions. It regulates blood volume. Does that by it's going to make you urinate, or it's going to make you stop urinating. So in dehydration, you stop producing urine. Okay, that helps with blood pressure. Stabilizes the pH. Remember, your lungs get rid of CO2. CO2 in water is carbonic acid, which becomes acidic. So your blood could become acidic because your lungs are damaged. So if your lungs are damaged, we do a urinalysis on people. If your lungs are damaged and we do a urinalysis, we'd expect the urine to be more acidic because the kidneys can get rid of hydrogen. So the lungs and the kidneys work hand in hand to try to keep your blood at the 7.45 pH. So if you have damage to your kidneys, you can get something called like Kussmaul breathing, where you're breathing more rapid to try to blow out more CO2 to try to maintain your blood pH, because you're going into renal failure.
We actually had one of the professors, something happened to him. He said he got a what? I don't know if you know Professor Biggerstaff.
Yeah, I know.
Yeah.
He got pneumonia.
You got pneumonia?
Yeah. He said he has been diagnosed with that, and hopefully he feels well. Like, I don't know, because of like all the finals and stuff it's going on. It's crazy. I hope he feels better.
Yeah. And the other thing I want you to be aware of, so your liver detoxifies your blood, your kidneys get rid of the waste products. And your kidneys are where we get calcitrol, so it's the active form of vitamin D. Okay. So kidneys are fairly important. Kidneys are simple though. Okay. So when it comes to your kidneys, we're going to have, so here's our kidneys. On top of the kidneys is going to be our adrenal glands. The kidneys are attached through the ureter to the urinary bladder. So the bladder is actually made up of transitional epithelial tissue, so it can go from being like a cube shape to flat, so it can expand. The muscle around your bladder is called the detrusor muscle. The detrusor muscle squeezes, we're going to urinate. So we have our urinary sphincter right down here, and then we have our urethra. And they always make a big deal that, you know, the right kidney is like lower than the left kidney and stuff like that. And I don't know. It all has to do with the liver being so big. Now, your kidneys are retroperitoneal, so they're behind the peritoneum, behind the mesentery, and they are protected by your ribs. So they're protected by your lower two ribs, ribs 11 and 12. You can see your kidneys are really close to your spine. Now, I don't care about the size of the kidneys. You can see right here, retroperitoneal, we have the stomach muscles and all that stuff behind it. Okay. So the renal cortex is going to be the section right here, and the renal pyramid is this section down in here. Now, the renal cortex and the renal pyramids, what they're going to have in there is the functional unit of the kidneys, which is going to be the glomerula. The calyx are just where you have like collection of the urine. Okay. Now, what I want you to be aware of here is when it comes to our renal arteries. The renal artery comes in, comes all the way down, and it gets smaller and smaller. And then when it goes into your kidneys, it's going to get into something called the nephron. The nephron is going to be the main unit of the kidney. We have millions and millions of nephrons throughout the kidneys. Now, after the blood goes around the nephron, it's then going to come out through the renal vein. So the afferent is going to add blood into the kidneys. The efferent is going to be the vein that brings it out. Now, I think it's every 50 minutes, every drop of your blood goes through your kidneys to be purified. Now, let me see. I need to get in here so I can actually show you. Okay. So we have in here this little like capsule. So this capsule right here is referred to as the Bowman's capsule, or the glomerula. So the Bowman's capsule is this capsule. Your afferent artery goes in, and now that artery, what it does is it turns. Let me get a different color. That artery, it starts to turn and spin, and it has all these like movements in there. So that's the glomerulus. So while this artery is spinning around, what it's doing now is it's causing the blood to slow down. So the blood is slowing down there, but we still have pressure of blood pushing on it. So what happens now is the pressure builds up in there. When the pressure builds up in there, it pushes a lot of liquid out of our blood. So that pressure acts like a big pressure on the sponge of this, basically this small arteriole. So that causes leakage. So we're going to push a massive amount of liquid out. That liquid now is going to go into the Bowman's capsule. Okay, so right here we have the artery comes in, the glomerulus, it spins around on everything, and it allows this liquid to be pushed out. That liquid then gets pushed out, and it's called filtrate, and it fills up the Bowman's capsule here. So as it's filling up that Bowman's capsule, it then starts to go down through here, and it goes into our proximal convoluted tubules. Just means it spins around. Proximal convoluted tubules, we start to absorb a lot of our electrolytes and everything. But how do we absorb those? You have to realize that this artery that comes out of our glomerulus, it now comes over and it wraps around the rest of the nephron. When it goes around this nephron, it then forms a capillary bed. So now that capillary bed is now going to be absorbing nutrients. So it reabsorbs stuff that we need. So we're actually going to create, like 15 gallons of filtrate throughout the day. But we're going to urinate out like maybe a couple of cups because we reabsorbed all the water and nutrients that we needed to. But we purified, we cleaned so much of it that it was very efficient. So I just want you to be aware of things that happen, and this is what they don't teach you. This is why you need to know this. So if we have diabetes, with diabetes we have too much sugar in the blood. I want you to think about the sugar in the blood as like little sandpaper. So the sugar in the blood, what it starts to do is it starts to put little holes in here. So it starts to put little holes in this glomerulus. So as it's putting holes in here, you're like, okay, well, it's causing more stuff to leak out, and it does. That's the reason why one of the first signs of diabetes is excessive urination. But then those holes, when this glomerulus heals up, those holes now are going to heal up as scar tissue. So now that scar tissue becomes hardened. Remember the very first day of class on the discussion, I asked you if scar tissue only form on the skin, and everybody said, no, it can form anywhere. Well, now the scar tissue is going to make it so this glomerulus is not going to be able to let the liquid go through it, and it's going to start to get damaged. Eventually, it's going to be so damaged that it's not functioning. If liquid doesn't get pushed through this, then the convoluted tubules, the ascending, the descending, the loop of Henle, all that stuff doesn't get any filtrate in there, and it starts to shrivel up and die. So it's going to kill the kidney, which is the reason why diabetes is a leading cause of what? Renal failure. Oh, but most people that got diabetes also have high blood pressure. High blood pressure can do the same thing. So if you have blood pressure is too high, your kidneys are very fragile. So now the blood pressure can start to put holes in here too. And the same thing's going to happen. It's going to heal with scar tissue. And that glomerulus is going to die, and then the whole nephron dies. Which is why hypertension and diabetes are the two largest causes of renal failure.
Would that cause also UTI?
We'll talk about UTIs. Yeah, that's not going to cause the UTI.
Okay, I see that.
Yeah. Okay, so now we have the descending limb going all the way down. It gets very narrow. When it gets more narrow, what it does now is it makes it so the concentration of ions and things that we want to have reabsorbed becomes greater, so now we can reabsorb that stuff into your blood vessels. The ascending has more water than it does nutrients inside, so now we're going to absorb more water. Then the distal convoluted tubules, that is where antidiuretic hormone works, which causes you to either hold on to liquid or get rid of liquid. It's also where Lasix works. Lasix is a distal loop inhibitor. So it inhibits the water from being reabsorbed, so it makes it so you make more urine. They give people Lasix when they have very high blood pressure or congestive heart failure. Yeah, there's a better picture of the nephron. Okay, now, what I want you to be aware of here, so this is a male, you can tell because of the prostate. Women, you don't have it. So this is your urinary bladder. Your urinary bladder is made up with a couple layers of muscle, and that's called the detrusor muscle. Okay? When it squeezes, it's going to push the urine through the urethral sphincter into the urethra. Now, the thing about it, ladies, urinary tract infections are pretty common because your urethra is very close to your vaginal canal. Okay, so your urethra and your fun zone are very close to each other, which is why you're very prone to getting urinary tract infections. You talk to any one of us men, and we're going to tell you right away that our urethra is at least 12 inches. Okay? Now, the thing about the urethra is it goes through the prostate for men, which is why when guys get old and the prostate starts to get enlarged, it pushes on the urethra, and it makes it so it's harder for us to urinate. Our stream isn't as good, and we don't completely void our bladder. So it feels like you have to pee all the time.
Is that true? Some people born with like a smaller bladder?
Probably. So as you can see here with men, so we have the urethra right here, and that comes out. So this is your urethra. Oh, hold on a second. It's also, this is from our testicles, our seminal vesicles. This is our vas deferens. This is where the sperm is going to come out. It goes over the bladder, and it comes around, and it mixes with some of these glands. And then it goes through the prostate, where it gets prostatic secretions, which now activate the sperm and get them started swimming. And now the urethra becomes the ejaculatory duct. So this is also why, if you see like blood in your semen, then that's a sign of prostate cancer. Now, you hit a certain age when you start to go to a doctor. See, you have a few birthdays, and next thing you know, as men, you start looking for doctors that part of the qualifications are you want them to be a little bit petite. Because when they go to check your prostate, they're going to stick a finger up your rectum, they're going to start pushing on this thing. So you don't want that guy that actually like had a scholarship to medical school that played offensive line for the football team, who's got big old like banana fingers. So with women, you can actually see we have the uterus right here, the urinary bladder, and the urethra. The urethra is pretty small, and it's really close to the vaginal canal. So that's the reason why the chances of getting urinary tract infections are so much greater for females. All right, that's pretty much it for that. All right, so everybody now can see the reproductive system. Oh yeah, by the way, with women and guys, it can happen. But if you get a urinary tract infection, a UTI, it can eventually go up and it's going to go into your bladder. Now you have a bladder infection. If it grows through the bladder and it gets into your urethra, then it can actually go all the way up into your kidneys. And now you actually have something really dangerous because now you're going to start to damage your kidney with an infection.
Actually, I was thinking about this yesterday, and probably after the kidneys, because it's like filters everything and all of that, and it can get worse and worse and throughout your whole body if you don't like get rid of the infection, right?
Well,
it gets like really bad.
There was a former Bond girl, James Bond movies, who when COVID first hit, she was so afraid to go to the doctor or the hospital that she got a urinary tract infection. It got into her bladder. From her bladder, it went all the way up into her kidneys. From the kidneys, it got into her bloodstream, and she went into sepsis and died.
Yeah.
And if she would have gone in earlier and just taken some antibiotics, she would have been okay.
Mm.
Why do you...
Usually when you have like whether the UTI or any kind of like other infection, you do have like you get what it's called, fever, right?
You get a temperature.
Mm-hmm.
But you also feel like you have to pee all the time. And the reason why is because your urethra is getting inflamed, so the opening is getting smaller, so you can't get as much urine through. Plus, your body says, hey, get more pee going, because you want to pee to push the bacteria out, because it goes in one direction, the flow of your urine.
Would that put also pressure on the kidneys too? Like you feel it? Mm.
So you can wind up getting pressure built up, and then that can cause damage to it. Men have a greater chance of the prostate getting enlarged, and that causes pressure to backflow. And that can damage the kidneys as well.
Mm.
Why do you drink? Why is cranberry juice supposedly so good for a urinary tract infection? Cranberry juice, what it does is it makes it so the most common bacteria are Enterococcus and E. coli. Sorry, but both of those come from your rectum. So both of those bacteria, if they get into your urinary tract, what they have is something called adhesion proteins. And they're going to adhere to the wall of your urethra, of your ureter and your urethra, and try to grow up. But cranberry juice makes it so that the wall is too slippery, so that those bacteria can't hold on. So when you urinate, you're going to wash it out. That's why they say after intercourse, you should probably go and urinate to try to make sure you're not going to get a bladder infection.
Yeah.
Okay. Let's see. Oh yeah, and the other thing too is kidney stones. They tend to form more because you have... So if you get kidney stones, most commonly it happens because you're chronically dehydrated. So chronic dehydration means that these ions that are being sorted out in the nephron, they get in that filtrate and they wind up coming together and sticking. And eventually it can form something called a calcium oxalate. So your most common kidney stone is made up of calcium. So if you're getting kidney stones and you're like, I'm drinking a lot, they're going to check and see if your parathyroid hormone is high, because parathyroid hormone puts calcium into your bloodstream. That can lead to kidney stones. But most commonly, kidney stones are because we're dehydrated. Okay, so part of the definition of being alive means that you can reproduce. So, for humans, male and females, that's what it takes to reproduce. So your reproductive system is going to store, transport, and everything gametes. So gametes on a male is sperm. Gametes on a female is the oocyte. When the gametes come together, the sperm and oocyte come together, and they get fertilization happens, it becomes a zygote. A zygote is a fertilized egg. So they do in vitro, where they actually give the women the follicle-stimulating hormones, the luteinizing hormone, and she produces eggs. They're going to harvest the eggs off the ovary. They're going to take that, and they're going to artificially inseminate, which means they're going to get sperm, and they're going to inseminate. They're going to put the two things, the oocytes together, oocyte and sperm, and then they're going to fertilize. Once it's fertilized, they're going to put those fertilized eggs into the uterus, and hopefully they're going to attach, and you're going to be able to carry and have birth. So they actually take the sperm and the oocyte, fertilize, and they implant a zygote. Okay, so in guys, the gonads are your testicles, In women, it's the ovaries. Let's see. Okay, so as you can see here with men, it's pretty basic. We're not nearly as confusing. We put everything on display for you to see. So, we have our testicles, our scrotum. Now, the thing about our scrotum is when it gets cold, you actually see the ridges because your scrotum's going to get pulled up. So, in cold weather, scrotum gets pulled up. In hot weather, it hangs down because we want our testicles to be 2 degrees cooler than our body temperature, because we need to be that temperature in order for sperm to actually be produced. That is the reason why on hotter days it starts to hang down low. Now they actually will do if somebody's in a coma, they actually do something called the cremasteric, because the cremasteric muscles are the ones that are in the scrotum that actually can move things. They'll take a sharp object, a metal object, put on the inner thigh of the guy, and run it real quick towards his testicles. They do that, and they'll actually see if the scrotum is going to contract a little to try to move it out of the way. So it is a reflex. I've never told my wife that there's that reflex because I don't trust her with the metallic object in that direction. Sumo wrestlers are the only ones that have actually learned how to control that muscle, because the thing that they grab hold of, that like really huge like thong, they try to like rotate and squeeze and twist each other around, that can grind away at their testicles. So they've actually made it so they can control their cremasteric muscle to move their testicles out of the way. And this is going to make you look at a guacamole in a whole different manner. The testes, they actually hang with one higher than the other, just like avocados. Avocados always grow in pairs, and one tends to be higher than the other. Let's see. And this kind of shows you the production, what happens. So your testes and everything, they kind of grow inside of your pelvic cavity, and then eventually they drop down. Now, when your testicles drop down, they're going to go through, so we have your spermatic cord. This is your inguinal canal. Sometimes the testes do not drop all the way through. It's called an undescended testicle. If you don't take care of that, then that testes is not going to develop because it's too hot. And you can wind up with a child that has sterility. And here you can actually see the inguinal canal. If you lift too heavy, sometimes you can get a piece of your intestine that comes through here, and it can block and hit this. And so then we don't get the blood vessels to go in there, and that can lead to a problem, sterility. Don't worry about all this stuff. Just talk about the cremasteric muscle. It is just showing you how the sperm production is being made in the testicles. Yeah, don't worry about that too much. It's like all the nerve cells and all that stuff. They're too crazy on this. See, spermatogenesis, we all know about that. That is going to be where we have one cell. We produce 4 cells, 4 gametes with half the chromosomes. And you can actually see the sperm when it's actually like fully mature and ready to swim. Okay, on top of the testes is going to be the seminal vesicle. So seminal vesicle, that sits right on this area. The main thing about that is it's just the storage center for sperm that is ready to go. It's not activated, it's not swimming yet. Okay, so the ductus deferens or the vas deferens All that is this spermatic cord right here that goes up and around the bladder, goes through the seminal gland, through the prostate, and then it's going to be the ejaculate duct. Let's see. As you can see right here, the prostate gland, prostatic secretions activate, and it gets everything swimming. Yeah, so I'll talk to you about this. So, about 2 years ago, I went in for some physicals, and they did some blood work. And they noticed that my PSA, my prostate-specific antigen, it was high. So I went in again in a couple of months, and it got higher. I went in again in a few months, and it got higher. So my PSA was getting higher and higher and higher. So that's a marker saying there could be a problem with my prostate. So the doctor's like, look, we got to get things checked out. So I went in and I actually had a pelvic MRI. So I had the MRI done, and it came back that inside of my prostate, I actually had a couple of nodules. So because I had some nodules on there, they're like, hey, you got to go and get a biopsy. All right. So to get a biopsy, I go in, and all of a sudden, of course, I don't know why it had to be this, but I go in, and there's this nurse, just me and this nurse. And she's actually kind of an attractive nurse. She goes, I need you to strip down everything and put this gown on, like nothing on. Okay. So I do that, and she puts me on this table. And on this table, all of a sudden, there's like stirrups that pop out. And she throws my legs in the stirrups, and she straps them down with like leather and props them way up in the air. I'm like, what? Okay. So now I'm sitting there with my private parts facing right towards the door, legs up in the air. I've never met this doctor before. And he walks in, I guess I'm showing her, I wouldn't say my best features, but he comes in and starts shaking my hand and introduces himself. Now that is an awkward way to meet somebody. And what they were going to do was they were going to go in, he had the readings, and he was going to find where these nodules were. What they had to do then was they went and they took, okay, you ladies are familiar with this, the ultrasound wand that they put up in your vaginal area to actually look at your ovaries. They took that, lubed it up, and they shoved that up my butt. So now I'm sitting there with an ultrasound in my ass, and they're going after it, and they're looking at my prostate. And while they're doing that, the taint spot, which is referred to as your perineum, because it taints your back and it taints your front. So they give me an injection in this area right here to numb everything up. So now while they're doing this, they go, can you do us a favor? All right, yeah, sure, whatever you want right now. They go, would you mind grabbing hold of your penis and your testicles and holding them up so they're out of our way? So I took my health in my own hands, was holding it out of the way, so I'm trying to be polite. While they're sitting there with the tube, with the needle, and they're reaching in and they're doing biopsies. So they took a bunch of biopsies. There were actually 6 different nodules. So they went in and they had to go and take all these different sections off. And then when they're done, shakes my hand, and yeah, it wasn't fun. For the next couple of days, I'm not kidding you, I had a lot of blood in my urine. Some of it was chunky because it was clotting. Yeah, it was not a fun time. Luckily, it came back as negative. So I actually have some nodules, but not cancer, so I don't have to worry about that.
Did they buy you lunch or dinner afterwards?
Nope, didn't even get any roses, don't get any cards, didn't even get a how was it for you. Basically, and I tell the story because just a simple thing. When guys get to be a certain age, if they're afraid to go get their prostate examined, if they're afraid to go through things like this, yeah, it's embarrassing, it's uncomfortable, it wasn't fun. I hope to never go through it again. But it's better to be embarrassed, it's better to be uncomfortable, it's better to have all that stuff going on than to have to tell your family and friends, hey, I'm getting my affairs in order because I was too nervous to go and be uncomfortable. And when you get right down to it, it was weird to me, but to that doctor, I was just another asshole that day. So it didn't really matter to anybody. But I know that I'm healthy. And I tell you that because just that people know they got to get checked out because prostate cancer, if you catch it early, it's very treatable. It's just a lot of guys will not go in and get the testing done. So if you don't get checked, then you wind up with it going malignant.
It's usually for older though, like I would say 40 or 50 plus, right? Or
I'm 56.
yeah.
So yeah, that's the reason why with it inching up like that, it was like, okay, I got to go get it checked out.
Yeah, but usually for like younger
Guys don't have to worry too much.
Yeah.
But that's why if you do have trouble, like with your urination, get it started, or you can't write your name on a wall anymore because you don't have the stream you used to, you got to get checked out.
Can I say a story? Kind of different.
Okay.
My first week of baseball practice in high school, did leg day, super hard. Thought it was hard going upstairs. My thighs were sore. And like a week of this soreness went by and my pee was like dark colored. And honestly, I didn't make the connection. I thought it's because I had like miso soup or something.
Mm-hmm.
And I had rhabdomyolysis in both of my thighs.
Yeah, rhabdomyolysis is where your muscles are actually, they were so damaged, they started to break down. So the rhabdomyolysis was just the proteins and everything in your muscles. Some of those little guys, your body was trying to get rid of them because it looked at it, it's not supposed to be in here. So that's why your urine was a different color.
Yeah.
Kind of hard to recover from that too.
Yeah, it was, I think I was like out of school for a week, out of baseball for like 2 weeks, but I just remember like trying to go downstairs. I couldn't really bend my legs because it was so tight.
So painful. Yeah.
Yeah.
Yeah, it hurts. Let me see. Okay. So when it comes to the penis, we have what they refer to as spongy tissue. I don't know who decided to name it spongy tissue. If I was the one that decided to go and name it, I would have named it something like, lava stone, something cool. But they call it spongy tissue. So we have your spongy tissue right in these areas right here, and that is your corpus cavernosa. So that's the area that when you get excited, it fills with blood and it gives you an erection. Now, the reason why when you're young, your erections are much stronger and harder is because the blood flow is better. When you get older, some guys that can't get it up, they wind up taking some of these Viagras and stuff. And what the Viagras they hit the nitric receptors. So the nitric receptors actually vasodilate. So they open up the blood vessels so more blood can rush into the penis and you can get an erection. But here's the problem. When you take Viagra and some of these pills, that vasodilation, it doesn't just go to your penis. It goes to wherever your body says we need to have arteries opened up. Now, if somebody pops one of those pills, they're expecting to have sex. Now, what if they have a problem where they have a blockage in an artery in their heart? So if they're already taking nitroglycerin, which does the same thing, it hits the nitric oxide, which is vasodilator. So if they already are taking nitroglycerin because they have angina, a blockage in their heart artery, when they take that, it opens that up. Okay, now here's the problem. If somebody is taking nitroglycerin and they pop a Viagra, the nitric oxide receptors, they're going to open up, so you get an erection. But now you start having sex. So when you start having sex, if you do it right, the heart rate's going to go up. When the heart rate's going up, the demands for oxygen are greater on the heart. If you have a blockage, it's going to make so you start to have angina and attack. If you take a nitroglycerin, you already have too much distension. That nitroglycerin now, with the heart going really fast, it's going to dilate the blood vessels more. It's going to drop the blood pressure. Not enough blood gets to the heart, and we have a heart attack. Now, that is too much nitroglycerin. If somebody's having a heart attack and they take nitroglycerin, they're not on Viagra, don't be surprised when they rush to the emergency room. They just look really happy to be there. Because that nitroglycerin, the brain decided what needs to actually be dilated.
There was actually a comedy movie.
Yeah, that's what happens if you have...
I get heart attack. Oh my god, that was hilarious.
He took a nitroglycerin for having a heart attack. And yeah. Okay. So with you women, you're a little bit more confusing. I'm not going to go crazy on this. But just to understand. So the clitoris is up in this area. So the clitoris and the glans penis. The glans penis is the tip of the man's penis. They are homologous, which basically means it has the same type of tissue in there. So the tip of the man's penis has a lot of sensory receptors. The clitoris has a lot of sensory receptors. So how it feels on the man on the tip of the penis is how it should feel on the woman on a clitoris, homologous. The labia minora, okay, so that is going to be made up of the same kind of tissue as the scrotum. So it's going to have the same type of sensations. The vaginal canal is going to have the same kind of tissue as the penis, the shaft of the penis. So it should feel the same as sensation on the shaft of the penis. So as you can see, us guys put everything in a direct line. You ladies, you're up here, you're over here, you're over here, all over the place. So that's the reason why things are a little bit more tricky. But if you understand it, maybe it can help you. And that's probably going to be the one thing from this class that you're going to take today. Sorry, up in this area. That's the vaginal canal. Okay, so the one thing you need to be aware of is we have the vaginal canal. So the vaginal canal, I don't really care what you guys think you're packing to bring to the party, but you ladies are able to have the vaginal canal, and the cervix is going to open up enough to actually let a baby go through. So it is not very long, but it can distend pretty big. So this is the cervix, vaginal canal goes into the uterus. The uterus now, we have the uterine tube, and then we're going to have the ovary. It gets released from here, it goes through here into the fembria, and it goes to the uterine tube. As it's bouncing around here somewhere, this is where fertilization happens, in the tube. Then that oocyte, that zygote, is going to go into the uterus and it's going to implant. If it doesn't, we get an ectopic pregnancy, and that is a medical emergency. So where the follicle gets released, I just want you to be aware where that gets released from, that space, it becomes something called the corpus luteum. And the corpus luteum is going to produce progesterone. Progesterone and estrogen, they help to maintain pregnancy. Estrogen helps to prepare. Progesterone also helps to prepare. Estrogen then maintains the pregnancy. What keeps the progesterone being produced is going to be, if implantation happens, there's another hormone called human chorionic gonadotropin, HCG. HCG is the hormone that the EPT, the early pregnancy test, you pee on the stick, they're checking for that hormone. That hormone, what it does is it maintains the corpus luteum throughout the pregnancy. Okay. This is all
So
stuff.
pregnancy, is that why if sometimes you can get it wrong, you can get it right throughout those, like, the pregnancy sticks? And
The cycle and everything, but they're pretty accurate now. They used to be not as accurate. So I talked the corpus luteum. So luteinizing hormone, follicle stimulating hormone, all those things, they play a role in this. Okay, here we go. So just know this is the myometrium. That's the muscular layer, and that is smooth muscle. When that gets contracted, that's going to stimulate the release of oxytocin. Oxytocin from where? The posterior pituitary. That tells the uterus to contract, trying to push out a baby. During intercourse, if you do it right, it'll cause the same thing to happen, releases oxytocin. Okay. The lining of the uterus, that's the endometrium. Endometriosis is when the lining starts to grow, and it can actually block up this area right here. It can grow into areas that are not in the uterus. The endometrius, the lining also, is what gets sloughed off during menstrual cycle. That's the endometrium. Perimetrium just wraps around. Let me see. They go into a lot of details explaining all this stuff. How do you notice that? So that's the lining. Okay. What I want you to be aware of is this right here. If you take a look, here's how things work out. So we have your cycles. So your follicle stimulating hormone is really low right here. Luteinizing hormone is going to spike. So this is day 14. Okay, so on a 28-day cycle, you've now had your period. So you're getting ready for implantation doesn't happen. You start your period, first day of menses. Okay, that's your period. That's your menstrual phase. On that, all your hormones are low. Right here, like day 7. What happens at day 7 is an amazing thing. Your estrogen starts to go up. Okay, right around, I don't know, day 11. Okay, day 11, all of a sudden, so on day 11, all of a sudden my wife is like, hey, why don't you come over here and sit next to me? So this section right here, between day 11 and going all the way over here to like day, well, 22 or 23. What's going on here is this. This is the proliferation phase. So here the uterus is getting ready for implantation, but your estrogen levels are going higher. Estrogen levels are going higher and higher and higher. So this is the most plausible time for fertilization to happen. Okay, after day 11. So now your hormones are in the happy area. Estrogen's going up. Then all of a sudden, luteinizing hormone kicks up, follicle stimulating hormone kicks up, and we release that ovary. So release that oocyte. That gets released. As soon as that gets released, though, your estrogen starts to go down, but hey, progesterone now is spiking. So now it's like, hey, we're still in the game here. Let's get busy. Let's have some fun. But then all of a sudden, right around day 23, your progesterone drops down. Your estrogen has already dropped down. Luteinizing hormone dropped down. Follicle stimulating hormone dropped down. All your hormones dropped all the way down. And now all of a sudden, right around at day 25, all of a sudden I come home and it's like, hey, you know what? It's been a great couple of days, honey. Why don't I take you out to a nice dinner? You know, let's go celebrate, get some dessert or something. And she all of a sudden is like, you can't tell I'm bloated? This now is danger phase. That is the Haagen-Dazs cycle. Whatever you want to do, that is when all of a sudden you only look good if you shut up and leave. And this problem is, all of a sudden day 11 comes back around and I'm thinking I'm going to stay right here. It's going to be permanent. I'm never seen to be ready for this, and I don't know why I can't predict it. But that's just the way life is. Those are your phases. Let's see. Yeah, that's pretty good here. All right. How's everybody holding up?
Good.
Okay.
It's women. Nothing is predictable sometimes.
No, things get wild. All right. So we took care of that aspect. Okay. Know the difference between your autonomic nervous system? So for the final, autonomic nervous system and your somatic nervous system. Know the sections. Your autonomic is going to be your sympathetic and your parasympathetic. Know that the somatic is going to be your muscles. Know what your sympathetic and your parasympathetic do. Like your sympathetic is your fight or flight. Your parasympathetic is going to be your rest and relax. Know which one is under voluntary control. I'm not going to kill you on that one. Pretty simple.
Is the lab final going to be a bunch of crazy pictures and stuff?
Probably going to have some pictures on there. So.
No,
Yeah.
because the last one was like a bunch of pictures, and I was like, ugh.
I know, and a lot of the pictures, I don't like them because if we pointed at something and they're going to be like, what is this? And it could be like 2 or 3 different things. And you're like, okay. And then they name it different than, yeah. There's some problems with the lab stuff.
Yeah, sometimes like some of them are not like too clear or the way they highlight them, and then you get an answer. So that's what I'm scared of.
No, you'll do okay. The main thing also when it comes to your cranial nerves, know the cranial nerve, like the optic nerve and the olfactory, 1 and 2. The facial is one that goes to your tongue and handles the movement. Trigeminal is the sensation of your face. Understand what the limbic system is, where certain odors and stuff can stimulate an emotional response. Know what the conjunctiva is. The sclera. Know the behind the eye, the anterior is the aqueous. The posterior chamber, that is going to be the vitreous, which means that it's thick. Know the outer ear, middle ear, and inner ear. Remember, the outer is just like the tube. The middle ear is going to be where we have our ear ossicles. The hammer, the anvil, and the stapes. So just know what those are. Know that those are going to go to the cochlear apparatus. The cochlear apparatus is inside the inner ear. The inner ear is going to be part of your temporal. Let me see. Know what the lens does. Know what the retina does. The retina is where the lens wants to focus the light on it. So we're going to get the best image quality. That stuff's pretty easy. Know about the pituitary gland. So, where is it located? Know that the pars intermedia is in between. It's kind of separates out the anterior from the posterior pituitary gland, but it's considered part of the anterior. I don't know why they're so interested. The pars intermedia makes melatonin stimulating hormone, but they really do like to know that. Know what excess growth hormone will do. Know about oxytocin, parathyroid hormone. The adrenal cortex, remember that's the adrenal corticotropic hormones that comes from the pituitary gland. So the adrenal cortex, what does it do? Salt is aldosterone. Sweet is going to be cortisol. Sex is going to be it's the precursor to testosterone. So androgens. Know that when you're sleeping, you don't eat. So when you don't eat, you're going to release what? Cortisol. So cortisol is going to make glucose out of non-carbohydrates. So it's a stress hormone. Yeah, that's pretty good there. Know about hyperthyroidism, so it's not too hard. Know about blood. The main thing about it is, why isn't an erythrocyte a formed element? Because it's formed, it's not really, it is a cell, but it doesn't have a nucleus. It's a biconcave. It doesn't really have much mitochondria. Know that hemoglobin, it's iron, so it likes to have oxygen. It can hold on to CO2 as well. No difference between T cells and B cells. They're both part of what? They're both part of your immune system, but your T cells and your B cells, they're part of your lymphatics. So they are lymphocytes. Know that the neutrophils are the most common of your leukocytes. Neutrophils, they're the most numerous. That's how I always remembered it. Know that in a centrifuge, why do red blood cells wind up being on the lower area? No blood flow through the human. Know that the veins, So the veins, the systemic ones, they empty into the right side of the heart. From the right side of the heart, they go through the pulmonary artery to the lungs. So right side of heart, right atrium, right ventricle, pulmonary artery to the lungs. From the lungs, pulmonary vein to the left atrium, to the left ventricle, to the aorta, throughout the body. Pulmonary circuit, the pulmonary is going to be what? It's just going to be from the right ventricle to the lungs to the left atrium. Pulmonary circuit. Systemic circuit is throughout the body. Don't get confused on those ones. So remember, the only artery that has deoxygenated blood in the body is going to be the pulmonary artery, which goes from the right ventricle to the lungs. That's the only artery that will have deoxygenated blood because it received the blood from the body. The only vein that has oxygenated blood is going to be the pulmonary vein, which goes from the lungs to the right atrium, left side of the heart. Know what part of the wall is made with cardiac muscle? Know the septum, the atrial septum, the atrioventricular septum, to separate the heart into right and left halves. Know what the papillary muscles do? Know how arteries become arterioles? Arterioles go into capillary beds empty into venules, venules become veins. So understand how that works. The tunica intima is it's the inner lining of the blood vessels that mixes with the blood. The tunica media is the muscular area. The tunica externa is the outer area. Know what the valves in the veins do? They allow for blood just going in one direction. What makes up the vena cava? The superior vena cava is going to be the brachiocephalic. Brachiocephalic artery is going to be the, the crowd that goes up. Know what makes up the superior vena cava? There'll probably be a question on there. Let me see. Understand the thoracic duct of the lymphatic system. Know the lymphoid cells. They're going to be your T cells and your B cells. The immunoglobulins, be aware of what they are. Your IgA, IgG, IgM, and IgD. MALT is something I didn't talk about today, but MALT it's like mucosal associated lymphatic tissue. We find MALT located within our digestive system, so we are going to have white blood cells that go into our digestive system to try to keep everything clean in there. Know that dendritic cells are macrophages, and what they do are, in your lymph nodes, they will actually grab hold of, and they will kill something, a bacteria or a virus, and they will hold that antigen out. So they're going to display the antigen for a T lymphocyte to actually recognize that and mount an immune response. Know which lymphatic organ has red and white pulp? With the respiratory system, it's pretty simple. Know that when you breathe in, you want to spin the air around because you want to clean it, you want to warm it, you want to moisturize it, get it all ready. Understand that we breathe in O2, we expel CO2. We breathe in the oxygen, it goes through the alveolar. From the alveolar, it goes into our blood. Oxygen goes from the alveolar into our blood system. Alveolar also allows for CO2 to diffuse from the blood into the alveolar so we can blow it out. Know what the larynx is? The voice box. Know the alveolar. We're going to have your type 1 alveolar cells, the simple squamous epithelial tissue, type 1. The type 2 cells, they're going to be the cells that actually produce the surfactant to keep the alveoli open. Then we have alveolar macrophages that sit in there, and they're going to help to make sure that no bacteria or anything get in there and kills anything. Know what peristalsis is? Know that the inferior esophageal sphincter, the lower esophageal sphincter, is also known as the cardiac sphincter. Know what the lacteals do in your digestive system? They absorb the fat. Know the way that the large intestines is the ascending hepatic flexor, transverse splenic flexor, descending sigmoid colon. Know the order on that one. Know where the appendix is found, the vermiform appendix. Know what the large intestine, the main thing it does, it absorbs water. The small intestine absorbs nutrients. Should be pretty good there. Note the urinary tract does not involve the kidney. The urinary tract is the ureters, the bladder, and the urethra, because that is urinary tract. That's where the urine is going to travel. Urine is made in the kidneys, and it's made in the nephrons. Know that electrolytes, proteins, things like that, they're mainly absorbed in the proximal convoluted tubule. The distal convoluted tubule is mainly going to be to absorb water. Know why the bladder has the transitional epithelial tissue. What is the point in that? Know what the detrusor muscle is? Okay, pretty good on that one. You know what the gonads are. The perineum is the area located between the anus and the pelvic. It's the lower area. Know what the fembrae are in their uterine tubes, where fertilization is supposed to happen. Know what the myometrium is?
What was that?
The myometrium. So with the endometrium is the inner portion of your uterus. That's where implantation is going to happen. The myo, when you hear myo, that means muscle. So the muscular layer is going to be the middle layer.
Okay.
Yeah.
How many questions would be?
I think it's just 60.
Oh, that's it?
Yeah, it's not very. Know what the corpus luteum secretes?
So,
Yeah, we'll probably be okay on this.
so when the stuff the exam's going to be open?
I'll have it open probably by Thursday at the latest.
Okay. And then we have time till Monday, you said, or Sunday, like 31st or June 1st?
If you're not able to get to it, like if you have so much other stuff going on, if you were to do it on the first, I'm not going to mark anything off, but try to get to it as soon as you can on the first.
Okay.
Because I know it's kind of weird. Like this is the final, but you have all this week 9 stuff you have to do.
Yeah. Totally.
And the other thing too is make sure that the week 10, the discussion is just a one post. And I like you just to put on there, like, if the class, like what I could do better for the class.
And that's due as usual, right? And by when?
That needs to be done by Tuesday.
Oh, Tuesday. Okay.
Yeah, because I need to have that done, those points, so that I can get all your grades done. They want your grades turned in really by Wednesday, Thursday at the latest of next week. That way they actually know to put you into the right classes. So that's why they're like very regimented about when things have to be done in this week.